Welcome, everybody, particularly those of you who are joining at a very late time or early morning. Welcome once again to EPI-WIN. Thank you for joining this EPI-WIN webinar on a systematic, community-centered approach to operational readiness for public health emergencies. For those who are new to EPI-WIN, this stands for the WHO Information Network for Epidemics, for the science and knowledge translation in health emergencies. With these EPI-WIN webinars and the associated EPI-WIN Digests updates, our goal is sharing of emerging knowledge and scientific issues among global experts and the public on health emergency preparedness, readiness, and response in a way that is understandable, relevant, and actionable for decision makers and health workers for evidence-informed actions and policies. Today, we will give you an example of an event that took place that will take community resilience forward, and I hope this will help you move community resilience activities forward in your countries. We have for that, we're very fortunate to have Dr. Nedret Emiroglu, who's the Director for Country Readiness Strengthening at the World Health Emergencies Program in WHO. We also have Dr. Kai von Harbu sitting right next to me here. We have, he's the unit head for community readiness and resilience. We have Dr. Charles Kuria Juguna, who's the regional advisor for country readiness strengthening at WHO AFRO. And they will give an overview of the unique exercise in Ghana. Following that, we will have a panel discussion where Dr. Joshua Arthur, who's also with us, who's the National PHEOC Manager in the Ministry of Health Ghana. He will give the national perspective. Then we have Miss Sylvia, who's the community midwife, also in Ghana, who will give the update on the community perspective from this exercise. We have Dr. Patrick Mawupipmore Avavor, who's the Infectious Hazard Management Officer in WHO Ghana, and Dr. Claire Bentun from UK PHRST, whose support in this exercise was invaluable. Also with us is the person responsible for this whole event, Dr. Rim Kwang. He will, at the end of the panel discussion, moderate all the questions that you will be sending us. Before I hand over, some quick housekeeping. This is being recorded, and afterwards the recording will be made available on the website. We will have interpretation in French today, so please go to the interpretation global icon and access and select that. We invite you to post your name, location, and organization in the chat box so that everyone knows where you're coming from. And we would love to know more about you too. And if you have questions, please put it in the Q&A box, not in the chat, because sometimes it gets lost in the chat, and we would really like to see and respond to your questions and answers. Finally, some additional information. We will be hosting a community protection meeting on 7th May. That information, you should be able to see it now. Please do register. We have Dr. Nedret, who's our director, will be there. Dr. Mike Ryan, who's our Deputy Director General, will be there. And this is your opportunity to take part in a global WHO meeting that will shape the future of community protection. So there's the QR code there. That's a link there. Please do join this as well. With that, without further ado, I will hand the floor to Dr. Nedret Emiroglu. Dr. Nedret, over to you, please.
Thank you very much, Supriya, and good morning, good afternoon, good evening to you all. I'm very happy and delighted to welcome you to this first EPI-WIN webinar on community readiness and resilience. And I'm happy to see so many people from all over the world. As you know, the communities have to be at the center of any action for health. And that's true for health emergencies as well. And we say every emergency starts at the community, and every emergency ends with the actions of the community. So this is recognized much more now after the COVID experience, and the communities are now accepted and seen as a core element of all the work we do within health emergencies. Either it's starting on preventing an emergency, or being prepared and ready for an emergency, or responding to an emergency, or recovering from an emergency. And then another important element here is that the communities should be the major driving force, and their voices should be heard, not from only a government and sector's perspective, but we have to listen to the networks and leaders. We have to listen to the civil society and the most vulnerable individuals within the community. So actually bringing all that strength within the communities helps us to respond to the emergencies, be prepared and ready, and changes the trajectory of an outbreak or any health emergency. Now, recognizing this, the WHO framework for health emergency preparedness, response, and resilience has the community protection as one of the 5 interrelated subsystems, along with the major systems within the health emergency. These are collaborative surveillance, safe and scalable care, medical countermeasures, and emergency coordination. So the 5th one is community protection, which shows the paradigm shift from the past, again, putting the communities and their critical players into the core elements of emergency management cycle. So strengthening the community capabilities for prevention, preparedness, readiness, and response is essential. And particularly in that aspect, I would like to remind you once more the importance of readiness for emergencies, which means possessing all the capabilities and systems in a state which is ready to respond on time, promptly, effectively to any emergency caused by any hazard. So it is really a crucial interface between the longer-term preparedness efforts and immediate response actions. And it means that all aspects of the communities and local health system components have to have the capabilities to work together smoothly to respond to emergencies. So I'm really grateful to the government and the Ministry of Health of Ghana, who have accepted to work on this together with us as WHO, and both from the headquarters, Geneva, but also from the regional office for Africa and the country office of Ghana, together with a broad range of partners. And special thanks go to the UK HSA, who has been working hand in hand with us. And this is really critical to showcase to the other countries how this big area of community protection becomes an operational action in the field. And this is what you're going to hear today. So we have gone through a tabletop exercise in Ghana, Accra in January this year, and implemented the community readiness tabletop exercise. And this is one of the first operational activities under HEPR community protection subsystem, and it aimed to strengthen the operational readiness of communities for imminent threats. So in this context, it was specifically in Ghana, and assessing the operational readiness of communities and identifying the readiness gaps and priority actions, which we believe is going to be an excellent example to other countries. So with this, I would like to also invite the other countries who are interested on a similar exercise that we could provide our support. And I would also like to thank to those who have been leading this area, particularly, let me start with my team and Rim, who has been working so hard for so many years with the support of Kai and have been leading this work. And as I mentioned, I'm really grateful to UK Animal and Plant Health Agency, but also many partners like US CDC, USAID, UNICEF, IFRC, FAO, and to all the government, national and sub-national officers from the Ghana Ministry of Health and other community health work volunteers and community health workforce, environmental health and veterinary health from the local and district level in Ghana. I really believe the lessons from this pioneering exercise will be useful to many of you. And as mentioned, we are happy to continue to this work in other countries, in other regions as well. And with this, I'll welcome you once more and wish you a fruitful webinar, and looking forward to other examples that we'll be sharing in the future from other countries. Thank you so much, and back to you, Supriya.
Thank you very much, Nedret. Thank you for your leadership and vision in this area. Before we go forward to the presentation from my colleagues here, I'd like to hear from all of you. So, just like a quick Slido. Just give me 2 seconds for it to show up. Can you see it? No, it's not showing. Anyway, never mind then. In that case, we will try that later. We'd like to hear from you later, but I will go ahead and request my colleagues, Dr. Kai Harbo and Dr. Charles Nijuma, to share their presentation.
Yeah, thank you very much, Supriya, and thanks a lot, Nedret, for the reflections that you shared and the really great framing of this important webinar. My name is Dr. Kai Harbo. I'm the unit head for community readiness and resilience here in WHO headquarters. And I will just give a few additional insights from the global level that hopefully will start us off in this webinar and put some of this very, very important activity into the context of our ongoing efforts here at the global level to advance community protection within health emergency management. And I think Nedret has mentioned very important aspects to this already. Next slide. And of course, as mentioned, this is really one of the first concrete operational activities under our new HEPR community protection subsystem, where community protection is really one of the 5 capabilities that WHO will focus on moving forward in the global architecture for health emergency management. And I think this is really a very, very important recognition of the critical role of communities in any kind of emergency, and in particular of the importance of the joint decision-making with communities to ensure acceptance and uptake of public health advice, and also really translating this into healthy protective behaviors. I think this is and this is really what, of course, also we are focusing on in this specific exercise. And ultimately, we all know this can mean the difference between a localized contained outbreak and a rapidly expanding epidemic. And this is why WHO has really put so much emphasis on this important area, putting it at equal relevance as surveillance, clinical care, coordination, and access to countermeasures. I think this is really a very, very important paradigm shift that Nedret has mentioned as well. And within this HEPR architecture, community protection outlines 3 main areas. And all of these are really reflected during the exercise that we conducted in Ghana. And I will just very briefly talk on each of those. So we have community engagement, risk communication, and infodemic management. I think most of us are very familiar with this area. It's very, very well established. We as WHO has done huge progress in this area. And it really focuses on this meaningful engagement with the community, the building of trust that is so important, not only during the response, but also across the emergency management cycle as a sustainable approach. And this is really, this of course was a very important component of the exercise, with the participation of many community representatives. Then we have this focus on population and environmental public health interventions. And I think this is already kind of a shift for WHO to put a lot of emphasis on this important area. And it's also an important component of the exercise, where we're really looking at community capacities. And in particular here, of course, at capacities for detection and response. But in general, we also look at WASH, vaccination, PHSM, vector control, many important areas that are very, very relevant to, and where the endpoint for all of our activities is really at the community level. And then the last one is the multi-sectoral collaboration for social and economic protection. And there really we put more emphasis on the knock-on effects of many of the measures that we are implementing in response to emergencies, but also the participation of the intersectoral partners that Nedret has mentioned as well. And we had many of them represented in this exercise. Next slide. And just to say, and I think echo a bit what Supriya has mentioned already, HEPR as a whole, and we in the community protection subsystem, we put particular emphasis on partnership and whole of society approaches. And this is, of course, because there's such a diverse landscape of partners already present in this area. There are a lot of networks established, and we really aim to bring these into more coherence. And a very important event for this is our first partners meeting, which we will conduct on 7th of May. And we really hope that many of you can join this meeting, and we continue the discussions we are having here. Next slide. And this is my last slide. And just to say that while we work to advance this dialogue at the global level, we also focus in particular on support to countries in how to operationalize this. And this is, again, this simulation exercise was a very, very important activity around that. And simulation exercises in general are a key tool for us to strengthen operational readiness broadly, and in particular also at the community level. And here what is really key is that we bring together the national level, district level, and community members, and in particular also the community health workforce. And that's why it's so great to also have Sylvia here today in this discussion, and Joshua from the national level, to really show this, to facilitate this dialogue. This is the main purpose of this exercise. And of course, the facilitated dialogue to really concretely discuss mechanisms and capacities at a specific, using a specific scenario and walking through this. And I think there's a lot of lessons learned from this very successful piloting of this methodology in Ghana that we will hear more about. And we really hope to move this forward now and apply this in many other countries, but also take the next step in Ghana and continue this leadership role that Ghana has in strengthening the community capacities. And I think for that, it's really, I just want to echo the thanks that Nedret has already expressed about the great three-level collaboration with our regional counterparts, and you will hear next from our regional focal point charts, but also from the country level, the Ministry of Health in particular and their leadership, and also our key partners, and here, of course, in particular, UK PHRST, who are a very, very important partner in many of our activities, in many responses. We have worked with them, and now it's great that we continue this also around capacity building, and in particular, focusing on the community level. So with that, I'm really, I'm sure I will learn a lot during this exercise during this discussion about the exercise from all the speakers. And then we will have a Q&A in the end, and hopefully we have the opportunity to discuss a bit further on next steps. And then we really look forward to have you all also be part of our partners network with the first partners meeting on 7 May. Thank you very much.
Thank you, Kai. And Dr. Charles, now please give us an overview of what actually happened in Ghana.
Thank you very much, Supriya, and also want to appreciate my colleague here, Dr. Kai, and also Dr. Nedret, the director. My name is Dr. Charles Kurian-Njogona. I work with the WHO Regional Office in Afro, Brazzaville. I'll go straight to a few slides. I think we have really heard that these public health emergencies, they start and end in communities. And when you look at the international health regulations, they require that each country should be able to establish some capabilities at the community level that can help the country to be able to detect and also report and contain any public health threat. And for this reason, we are working with communities because we know that diseases can spread very fast in our current world where we are interconnected. We say that diseases can spread at the speed of a jetliner. Just takes one person who is infected to board a plane and can introduce the infection in another continent, in another part of the world. And working with communities is very, very important for early detection of public health emergencies and also for timely response. Let's move to the next slide. Yeah, there are simple tools that we can use and work together with our communities to ensure that we improve their readiness. And we have tools like checklists that are simplified enough to be able to assess the various capabilities at the community level. And those tools can help the communities to be able to come up with their own operational readiness plans at their level. And they can be able to implement those plans, and they can be tested through simulation exercises. When we talk about community readiness, there are several key components that are critical: coordination, community-based surveillance, public health and social measures, community-based health services, community-based response team, risk communication, and community engagement, and also access to countermeasures. And all this should be done in a One Health approach. Next slide. So this slide looks at the community readiness operation models. And I want to believe that it may not be exactly in every country, but it's a model that is common in most of the setups, especially in the African region, where we have the Ministry of Health at the district level, at the national level, linking with the health authorities at the district level, and also at the local health authorities that are linked to the communities. And at the community, we have various players that are very, very critical, and we need to make sure that we identify them and we work with them in areas of public health emergencies. Next. Yeah, we say that, and we have learned from COVID and many other public health emergencies, that preparedness always does not lead to effective response. And therefore, we need to move beyond preparedness and be able to build the readiness area. And this is a terminology that it's new to many people, but in simple terms, readiness is a bridge between preparedness and response. Therefore, apart from having a lot of preparedness capacities, we need to ensure that we take them a notch higher and ensure that they are operational, those capabilities can work in the time of emergency. Next slide. So the objectives of the work we did in Ghana was mainly to ensure that the community that was selected in Ghana, they were ready. And we focused on 4 key areas: early detection, early action, and coordination, risk communication, and community engagement. Again, doing all this in a One Health approach. Next. So these are the structures at the community level. In Ghana, we have the district hospital that links with health centers at the sub-district level, and they link with the community where we have various key people at the community level. And today we are very happy to have somebody from the community who will be speaking in this webinar. Let's go on. This is the map of Ghana and the areas that we selected. Basically, we looked at the eastern region and selected communities in 2 different areas which are interconnected, and there is trade between the 2 communities, and there are a lot of interactions. So meaning that there is a chance that if an infection is introduced in one of those communities, it can easily be transmitted to the other community on the west side. Let's move on, please. I will not go to all the details, but we had this tabletop exercise that brought people from communities and also Ministry of Health, and we divided them in 6 groups, and we worked with them to ensure that we understood better where they were in terms of the community readiness. And out of this exercise, we'll see what was the outcome. Next. The whole tabletop exercise looked at 3 sessions, whereby first of all, we had the word-borne infection being transmitted to animal. And we focus on, we know there are many zoonotic diseases, but for this case, we focus on the highly pathogenic avian influenza. The second was animal to human transmission. And the third one was the human to human transmission. Again, looking at the 4 areas I've mentioned in a One Health approach. Let's move on. And during that exercise, we did the readiness action planning, and we used very simple tools that the communities were able to interact with them, and they could be able to look at the various components that we had selected, and they were able to see what is in place and what is not in place. And that kind of an assessment helped them to be able to identify their strengths and their gaps. Next. So the key findings here is that the communities that we tested, we found that they had a strength in the area of immediate reporting. They have access to mobile phones. They can do WhatsApp messaging and also text. But we found that in terms of early detection, they had challenges in terms of risk assessment. They did have some standard operating procedures that they can use for early actions, and also the issue of understanding of outbreak response measures. In the area of coordination, there was very good coordination structures at the district level, but that was not replicated at the community level. And these are very important things to ensure that at the community level, we have some of these structures that will be used when they have any threat or public health threat. In the area of risk communication, we found there was an existing communication platform, but however, there were gaps in terms of how do you manage misinformation, and also the issue of 2-way listening mechanism was also a gap. In terms of the engagement, we found that there was trust between communities and the health workers. And this is a very important aspect in public health emergencies. And my colleague, Dr. Kai, has mentioned about it, ensuring that we build trust with communities. We don't wait until there's an outbreak. But even in the time of peace, we need to ensure that we build trust with communities so that they can work with us. The other thing is that the gap that was there in the area of community engagement is particularly issues of meaningful community engagement in preparedness, in readiness and response. Next slide. Almost done. Key recommendations here is just to ensure that we have trainings that are done at that level, at community level, and especially focusing on community fast responders, ensuring that the animal health is brought on board. We usually say that the strength of a chain is determined by its weakest link. So we can't afford to have one aspect in public health emergency that is weak, because it's going to affect the entire response. So working, also ensuring there is a community-based surveillance that is working is very, very critical. When these infections or outbreaks are not detected in good time, we'll be playing a catch-up game, which is difficult, especially when you're dealing with infectious diseases. Ensuring that we have community structures in time for coordination in what we would call a community emergency operation center. Very important at that level. In terms of risk communication, ensuring that there is a plan that can help us to communicate uniform messages across communities. And each country needs to look at their communities because this is not a one-size-fits-all, and ensure they have such a kind of a communication plan, and ensuring their SOPs for helping feedback mechanism. And lastly, in terms of community engagement and One Health, ensuring that there's strengthening of community structures in a One Health approach so that we do not miss some of these infections. We can catch them when they are still circulating among animals before they jump into human, if there is proper collaboration in a One Health approach. Next. I think those are the key things we have mentioned here. So we need to empower communities to respond to health emergencies. And you can see there, even the media were able to capture that very correctly in Ghana. That is the direction to go. Otherwise, lastly, I want to acknowledge the great partnership. Next slide. The great partnership between Ministry of Health, Ghana Health Services, WHO. We had also the UK Health Security, London School of Hygiene and Tropical Medicine. Of course, the Department of Health and Social Care, UK Aid, many other partners, USCDC, USAID, FAO, UNICEF. What it means is that we need to work together. We need to work together when it comes to the community level. Otherwise, thank you very much.
Thank you very much, Dr. Kai and Dr. Charles. What a nice ending. We have to work together. Together we can make things happen. We can make a difference. Fantastic. Let me quickly see if we can still do the Slido. I would love to hear from you. So please join slido.com and give the hashtag 6131258 or scan this QR code. And we'd love to hear from you. And let us know 1 to 2 key actions needed to ensure communities are ready to respond to the next health emergency. Very quickly, we'll have 2 minutes for this, so please share. Please write your opinion. What, in your opinion, are 1 or 2 key actions needed to ensure communities are ready to respond to the next health emergency? And okay, we see some answers coming in now. Training, security, communication, capacity building, information. Repetitive trainings, not just once, but over and over again. A capacity building, communication being the highlights here. Great. Please continue to give your inputs to this. We'll see the final results later. But right now, let's, since we are on the track of this event that happened, we will go over and hear from Dr. Joshua Arthur to start with on the national perspective. On this event. So Dr. Joshua, congratulations to your country, to Ghana, on hosting the first community readiness simulation exercise. But what is it that prompted Ghana? What factors prompted Ghana to conduct this event?
Thank you very much, Sophia. We are very happy to have a of this. Ghana has a long history and has always recognized the role of the community when it comes to public health surveillance.
Could you please put your volume up a little higher, Dr. Joshua?
From about 1980. Okay, that's a bit audible now.
It's better now.
Good. So from as far back as 1988, even before community-based surveillance was clearly established with the DSR system, the country realized the role of the community. And so there was a community volunteer system which helped us achieve worm eradication back in 2015, even though back in 1990s we were the second most endemic country. However, if we pay attention to recent outbreaks, you look at COVID-19, you look at the Marburg virus disease, you realize that there is a need to further involve and capacitate our local communities because they are very important collaborators in any emergency response. And so we appreciated that there was a need for proper coordination, clear roles, and expectations from all stakeholders, from the community all the way up to the national level. So when this idea of the community readiness simulation exercise was floated to the country's health leadership, it was a very easy decision to agree to be part of that. As a service, we have had a number of simulation exercises, and even in the past 2 years, the WHO has supported us to train and help all 16 regions to do their own simulations. However, this concept of actually having community members as the center of a readiness simulation was very welcome. And that is why we agreed to work closely with the WHO country office and the headquarters, as well as the UK HSA to actually have this exercise undertaken. And we're very happy with the various outcomes. As Dr. Charles and Karim has mentioned, the exercise actually has helped to assess how ready our communities are to help us detect any unusual public health events, and at the same time to notify and to be part of taking action to contain or control them. And at the same time, this exercise also helped us to actually find out how well we are working closely with our communities and the various intermediate levels of our health system and other One Health agencies. And so that is what these community TTX has actually helped us to assess. If I can talk about the lessons that have come from what we've done so far, we see that our community members are very important in terms of our preparedness, readiness, and response. They actually have a number of roles that they can play to help us. They are very useful when it comes to creating awareness throughout the whole public health emergency cycle, doing door-to-door visits to help get the community on our side, helping with risk communication and messaging for the community, case finding, contact tracing, and the rest. So very important roles for the community to play, and we cannot leave them out. The exercise actually showed us that our community workforce, they are good at detection, early warning, early detection. They are very good at that. But then the gaps that we've identified are also important for us to pay attention to. And so we are planning to build the capacity at the community level. We're going to have more structured orientation for our community-based surveillance volunteers, animal health workers, and other leaders at the community level. And then their knowledge that we have. So they have a lot of knowledge about their own community. We need to leverage that community knowledge, how we message, how we do risk communication. We need to bring them on board for that. And for our districts, we are asking that they include what we call a community engagement plan in their preparedness plan, because there they can tell us how they have involved the community in developing their preparedness plans and what specific goals they have actually set aside for the community workforce that we are working. So we're very happy to have been part of this, and we look forward to doing more of this. Thank you.
Thank you very much, Dr. Joshua. Some key points there. So Ghana has a long history of working with communities, and this exercise, as you said, was very important in finding out what communities, how the critical role of community showed up once again, but also you found out systematically where the gaps were, what they could do. They're very good with creating awareness for risk communication, but also in other ways where they could be strengthened to take this forward. We have some comments coming in here also on the chat. Communities must be informed to make informed choices. Another person said that community A and community B are different, therefore, each need to have their own. They have their own needs which need to be addressed. So now, let's go to someone. Let's hear a community voice. Let's hear it from the community. We've been talking so much about communities. We're very fortunate to have here Miss Sylvia Apa-Mensah, who's the principal community health nurse in Kauhu West in Ghana. So Miss Sylvia, in your role as the principal community health nurse, in a sense, you are the face of the local health workforce. You interact with community members every day. What did you find most useful in this exercise that will help you and help your community? Ms. Sylvia?
Thank you very much for that question. I know that I learned that emergencies begin from the community and end in the community. Therefore, if we have any resources, it should be placed at where emergencies begin, that is the community. So that in case there are outbreaks, we wouldn't miss important timings of early detections. We work with the people in our community, we understand them, they also understand us. And I'm proud to be part of the community health workforce. During the exercise, what I learned was that when there are emergencies, what you can be able to do during the time of an outbreak, who you work with in order to manage the situation at the community level. Meaning that when there are outbreaks, it is not only the health workers that are responsible in helping to manage the situation. Our stakeholders, such as the assembly members, the chiefs, and the volunteers, plus we, the health workers, come together as a team to manage the situation. And in order for us to have a good teamwork, we need to table down our roles and responsibilities so that each and everyone will know what to do at the exact given time. I think that one will help during our outbreak. And then who to report to, meaning timely and promptly reporting. To know the exact person you should report and should be at the right time. Immediately there is an outbreak. you wouldn't waste time in report. And also, during this time, you have to lessen the fears of the people in the community. When there are outbreaks, there is fear. Therefore, you know how to communicate with the people in your community to lessen their fears, as well as the families of the infected person. You reassure them, you keep encouraging them so that they can patiently wait for the client to have his healing. Thank you very much. Also, knowing something and then doing something are two different things. But during the exercise, we combine the two. And I think it was a nice experience, and it will help the community as we know something and then doing it at the same time together. It also helps us coordinate more with our opinion leaders or our stakeholders. There's that kind of communication and trust between the local leaders, or let me say our stakeholders, and the health staff. So there's that kind of cordiality that will also help during our and then also we need to help to maintain the trust between the community people and the health workers in our community. Also, it helps One Health, bringing all other agencies together like the veterinary and then the environmental. We all need them at the community level to work hand in hand during our outbreak. Whether it is from animals, then we need the veterinary, the environment, we need the environmentals to come together to work effectively. Thank you very much. Over.
Thank you so much, Ms. Sylvia. Some very, very pertinent points here. You know, when you talk about patients, when there's outbreaks, there are fears, and we need to reassure and encourage the family of those affected, as well as the fears. Also talking about knowing something is not the same as doing it. And in this exercise, when you actually did it, you realized what it meant to do something. That is so pertinent. And finally, that we all have our roles. It's not just the community health workforce that's responsible for outbreaks. Everyone is in managing outbreaks. Everyone has their roles, and including the One Health approach, working with the environment. We have to work together. And on that note of working together, I would like to invite the partner perspective, because we have to all work together with partners to get ready for any health emergency from the community aspect. And we are very fortunate to have Dr. Claire Bantoon from the UK PHRST, who's been a staunch supporter of strengthening community resilience, and this exercise in particular. So my question to you, Dr. Bantoon, is why is this useful? Why did you support this exercise? Why is this useful? What's the benefit? Will UK PHSRT support such exercises in other countries? And is there something you would like to see done differently from this experience? Over to you, Dr. Claire. And thank you very much, Ms. Sylvia, once again, for your fantastic points and for joining us today.
Thank you, Supriya, and yes, thank you, Sylvia. It's a pleasure to see you again. It has been lovely just watching in the chat all of the different places in the globe and the roles that you are doing as an audience at this current time. So thank you for sharing your names, roles, and places where you're based. It is a real pleasure to see that. And thank you for inviting me to join this panel. It's a pleasure to be with my colleagues here on the panel today and see old colleagues here attending. So your question is, why is Public Health Rapid Support Team involved? So a little bit about that. The UK Public Health Rapid Support Team is a collaboration between the London School of Hygiene and Tropical Medicine and the UK Health Security Agency. We are funded by UK taxpayers through the Department of Health and Social Care, and our remit is to support countries that are lower resourced in order to be able to support outbreak, epidemic, and pandemic preparedness and response. We are very grateful to have had the opportunity to collaborate with the WHO Community Readiness and Resilience Unit under Rim, Kai and Nadret in this work. We have 3 pillars of RST. So one is deployment in outbreaks, another is research about outbreaks, and the third is capacity strengthening. I'm head of capacity strengthening, and it's under that pillar that we are working with the WHO CRR unit on this work. So the WHO has been developing guidance on readiness, and they have a guidance document, which is actually a WHO readiness checklist that's been developed through expert consensus and validated in that way, but it needed to be validated actually on the ground with communities to see whether it is suitable, that its purpose is being met, and that indeed that it is going to be applicable to those communities. And it is those communities that have the insights to be able to do that work, but also they have the trust of their communities to be able to deliver on that checklist. So that was after some time of looking at where we might work. Ghana was selected. I was particularly pleased with that because I used to live in Ghana. So I was going back home and spending time in community and with old friends. So a pleasure to be working with our colleagues there in Ghana. So the tabletop exercise also allowed us, with my role as capacity strengthening, to incorporate aspects of One Health, of preparedness, and as well as leadership, because leadership is at every level. And certainly working with our community participants, we saw leadership in every single one of those participants. They are actually leading response in every outbreak. As has been discussed earlier, outbreaks start, they are managed, and they are ended in communities. The pandemic, the COVID pandemic, exposed divisions within and between countries. It exposed those great inequities, and it really showed that there are significant gaps in preparedness, response, detection, and indeed the process of recovery and the tools and opportunities for recovery. So that's why it is the remit of Public Health Rapid Support Team to be working to support those, and doing that now, as has been said, recognizing the community as being the center of this. Health emergencies are just ongoing all the time. They're emerging all the time, but they're going to escalate almost certainly as climate change impacts develop. That also will lead to further conflicts, and currently we're in a very geopolitically unstable world. Outbreaks follow where you have any of those scenarios, and there is always a disproportionate impact on countries and communities who have fewer resources and those in our societies that are vulnerable. Previously, outbreak management has focused on the technical areas, areas such as the labs, the surveillance systems, and indeed the clinical management. Community engagement has been in documents and policies and reports, well, for at least probably 2-3 decades in nearly all of them. But I would say it's only now, and it's really with the focus of the WHO CRR unit, that we are really working to develop the tools, the frameworks, and understand the systems, and doing the work to really do things from the perspective where the community is the center of that preparedness and that response, and you can build the resilience at that community level. So that's why, for me, it is really important that the Public Health Rapid Support Team is committed long-term to this partnership and to this arena of work, addressing what really is going to matter for outbreak management every single day and for the future. So I just want to say a few words about partnership. I've been brought to this panel as one of the partners. Working with our colleagues at WHO HQ, WHO Afro, Ghana Health Services, and much wider than that, there have been many partners that have been involved, has been an absolute pleasure. I have said previously, we delivered this exercise in Ghana as one team. There's great warmth and there's enormous rewards in the work that we have done. And I just want to mention just a few names of individuals that can't be on his panel. My colleagues, Yanni, Pippa, Christina, Lester, have all been absolutely instrumental in the development and the reporting of this exercise. Our colleagues in Ghana at the WHO Ghana office, Kojo, Dr. John Otto, Sally Ann, and indeed Selma, were absolutely phenomenal colleagues. I know some of them are on this call and I want to show my appreciation. And then from WHO Afro, Charles, who you have met, Dr. Gennaro, and Julienne, absolutely phenomenal colleagues for the successful delivery of this activity. I thank all of you for making it such a pleasure. But in particular, I want to thank all of the community participants. They came open-minded. They committed all of their focus and time throughout the tabletop exercise. They brought really rich insights and they allowed us to be able to develop and do iterations to the checklist to make it fit for purpose and to develop our insights as to how applicable it is in those different environments. It was lots of light moments, although it was serious business being done, serious work being done, lots of light moments and fun had as well. And it was good to share those times with you all. So from here, I just want to recognise that there is, as has been mentioned, an expectation that we will be delivering a community first responders training, which is coming out as recommendations from the tabletop exercise, developing that curriculum and doing that in conjunction with our colleagues, all of the partners that we've described, but particularly those within Ghana. And that would be a train the trainer model, so it could be rolled out and have impact, I hope, at scale within Ghana. This work, the readiness checklist, the testing it through the tabletop exercise, the managing the outcomes, and for example, the community first responders training, is all going to be relevant for other countries as well. Made bespoke, obviously, to fit the appropriate context, needs, and working relationships in those countries. And so from the Public Health Rapid Support Team from the UK, I commit our interest, our partnership to continue this work so that it may have as best impact as possible. So thank you all of you for inviting me today, sharing this time together, and I hand back now to Supriya. Over.
Thank you so much, Claire. Thank you for sharing with us the very concrete support as a partner. And that's good news for everyone in this field, actually. And some very pertinent point. Of course, we have to, if we had the checklist, it needed to be to see how it works out and made fit for purpose. And this was the first step in a sense. Great that there will be a community first responders training with your support. But what I thought was really important is what you highlight about leadership at every levels, including leadership at the community. That's really very important. And of course, being from WHO, I'm very happy that WHO and my colleagues here led this initiative. I'd now like to invite our leader in the country, Dr. Patrick Avavor, to talk about WHO's role. So Dr. Patrick, this is WHO's first major exercise for community readiness under the new framework for health emergency prevention, preparedness, response, and resilience. That's quite a mouthful, but we refer to it as HEPR. How do you, in your perspective, what were the key takeaways from this exercise? And Claire just mentioned that, this is the first step, we will be moving ahead. So what do you think are some of the key action points and how will we move ahead? Over to you, Patrick, to give us your perspective from the WHO country office.
Yes, thank you very much, Supriya, and thanks to the earlier speakers for the very insightful contributions they have made to the discussion. As has been mentioned, it's exciting that Ghana is a trailblazer in this area, piloting the community readiness simulation exercise. And as has been mentioned, This is one of the first operational activities under the HEPR. I think one of the things that resonates all throughout the activity is an understanding and appreciation of the core principle that health emergencies start and end in the communities. And so whatsoever resources and capacities that there might be should be placed closest to where outbreaks can start. Those are the communities. And to ensure that should anything start, we recognize it early, detect them early, report them early, and at least put in place critical control measures and in time. And so with this Ghana's tabletop exercise, what we actually did was to simulate, yes, an outbreak. It has been mentioned already that we looked at a zoonotic disease in the interest of One Health, which is a very important approach in the world today, and trying to operationalize One Health at the lowest level. And so in that, we looked at a potential disease that could start from poultry or animal health and then be passed on to human health. And I must say that also in the interest of One Health and partnerships, this was delivered with and in collaboration with the Ministry of Health Ghana Service. I think key partners have been missing in the discussion so far: the Veterinary Services Directorate, the National Disaster Management Organization, and among the host of partners, I think it's also worth appreciating the Red Cross for their contributions. In fact, Red Cross did a field testing of the tools that we used in the exercise. Now, during the 2.5 days of the simulation exercise, we got a chance to review operational readiness at the community level, at the lowest level as possible. And in doing that, we included areas such as existing emergency preparedness and response plans, capacities, mechanisms, and procedures to detect spillover events of emergency public health threats, and then also to take preliminary response actions together with community members and to protect their communities. While we did that, we also made sure to identify the gaps. And through the gaps, we were able to come up with an action plan. And in the earlier presentation, I think our senior colleague, Charles, gave an overview of the action plan and the gaps, and then the key things that we hope to do moving forward. So I would like to focus a bit more on what key things that we want to move forward with. I think one of the important recommendations from the exercise is really to empower the community stakeholders, including community health committee members, community health workers as first responders to health emergencies, and to provide them with the necessary training in performing early detection and initial response actions to the imminent or anticipated threat to the community. And this has been very well articulated by Sylvia, that the community level capacity building needs to be enhanced. Another interesting finding was in the area of communication at the community level. It's exciting. Claire spoke about leadership, but to get the machinery working very well, communication is key. And so we noted in the session that yes, there were existing platforms for communication, but there were very real challenges, including misinformation, the lack of feedback mechanisms, and addressing community concerns, such as stigma and livelihood loss. Maybe when we're talking about zoonotic diseases, we've had experiences with HPAI in Ghana. We've had experiences with anthrax. The community members be thinking of losing their livelihood, losing their livestock, losing money. And how do we actually partner with them and allay their fears and to put some mechanisms in place so that they are protected from these events when they happen. And then also finally in the area of communication, were recommendations that were focused on co-developing risk communication plans with the community and also enhancing community involvement in the plan development process, and then SOPs and then trainings to address these events when they happen. Towards the end, several critical next steps were identified, and key amongst them was an exercise evaluation report and an action plan, which is now publicly available. And then, so we plan to disseminate the findings with key partners in the country, and then also with partners who can also support the implementation of the action plan. And we'll be doing this hopefully together with the Ministry of Health and Ghana Health Service and other key partners in country, and of course, including the UK PHRST. Now, on the ground, some of the activities that we hope to implement from the action plan is actually to strengthen and empower community health management team members, which are the decision-making body at the community level when there are any events or outbreaks at that local level. And then also to train community health workers and volunteers on early detection and response actions, as well as basic community emergency management. It's heartwarming to also note that already WHO Country Office Ghana, using support from the Pandemic Influenza Plan, has already initiated some community level communication activities. And in May, there'll be a lot of such capacity building activities happening in one of the regions in Ghana throughout the month of May. As I wrap up, I just want to also highlight that for us at the country office, it was a very exciting and useful exercise for us to determine the actual community level capacities that are on the ground, not what is in the books, as Sylvia mentioned. Knowing something and doing it are actually very different things. And so getting the chance to operationalize what we know and identifying gaps and improving on them was a very invaluable opportunity for us as a country. Also to highlight once again that outbreaks start in the communities and end in communities, or you must put resources where they are most needed. Also to mention that strengthening community level capacities to prevent, prepare for, detect, and timely respond to health emergencies is key to keeping the entire world safe, starting from the community level. And I'm elated that Ghana has had this experience. And I believe that this tabletop exercise or simulation exercise can be replicated at various levels and in different countries. And I invite everybody who is connected to this webinar to take a cue. And then if you are interested, please reach out. I'll be happy to support. And I'm also confident that there are governments and other organizations out there who will be willing to support this initiative. So thank you very much for the opportunity to share our story with the entire world. Over to you, Supriya.
Thank you very much, Patrick, for that overview and for letting us know about moving ahead and the action plan. And great to know the action plan is in public. And most importantly, reiterating that outbreaks begin and end in communities. We're actually running almost up to time now, but we would love to hear from the audience. So perhaps since we started a little late, we'll go over a little bit, if that's okay with all the panelists. And I invite my colleague, Dr. Rim Kwang, to moderate the Q&A session here. So over to you, Rim.
Thank you very much, Priya, and also thank you very much, the speakers, all elaborating in an excellent way whatever we did in the Ghana. I think this is a great opportunity also all of us to speak to people in the world that how this pilot activity can also replicate in other countries. I saw question and answer part, and already a lot of questions came, but I see that some of the questions already answered while presenters speak. So probably we may not address all the questions. And also I see that also there will be opportunity later that we can also engage with those to address those questions specifically. So also considering the time limitation. So first question I want to ask is that what is an appropriate tool for planning for community protection, including the national policies, laws, and strategies for social protection in the country, especially in the developing country? I'll hand over this question to Dr. Kai, because Dr. Kai just spoke about the community protection from WHO side in relation with how we really put the operationalized community protection in the national and country level. So hand over to Kai.
Yeah, thank you very much, Rim. And I think I touched upon this in my presentation. The last slide that I showed was really trying to introduce a tool that we are developing based on this experience from the simulation exercise in Ghana that really looks broadly at all aspects of community protection. And this will be a methodology where we can have a similar scenario-based gap analysis and action plan development across the 3 levels in a country. So again, with national level, district level, and in particular, of course, community level participation. And then really through a systematic approach, going through a scenario of a health emergency that is relevant to the context of the country, across the 3 objectives of the community protection subsystem, looking at what are the capacities and methodologies in place. Are they really in place, and really having that kind of reality check through the community representatives, including community health workforce, but also intersectoral community representatives. And of course, as mentioned already, I think previously, for example, civil society organizations and other key partners and representatives that can speak on behalf of the community. So this is really a methodology that can look beyond only the health system in itself. Of course, we are focusing on health emergencies in this exercise and in community protection as a whole, but we look really at the multi-sectoral context, including the social and economic factors that I think that were mentioned in this question. And we are happy to share a bit more information on that methodology with you if you're interested. Back to you.
Yeah, thank you very much, Kai. And I will pick up another question, which is a bit specific question. What is the methodology to conduct the community-based surveillance, and what were the document-based practices? We understand that there are different practices in terms of community-based surveillance, depending on country, even in one country, depending on the community. Therefore, probably since we conduct this community-based simulation exercise in Ghana, probably we may ask whether Minister of Ghana can share some of the experience related with community-based surveillance in Ghana context, whether any document-based practices in Ghana context. So probably I can hand over this question to Dr. Joshua. If you can elaborate a little bit on that from Ghana context.
Okay, thank you very much. Yes, so community-based surveillance, there is a clear SOP. We have a system of selecting community surveillance people with consultation with the local authorities, so that is community-led. They also have various definitions that they are trained on to use, the reporting channels, and there are various reporting tools. So there's a clear way that they are involved, and there's also something similar with the animal health aspect. So there's some guideline about this. The effort is to improve how it is done and to actually capacitate them to do more than we are making them do now, especially learning from this readiness assessment. Thank you.
Thank you very much, Dr. Joshua, for giving us experience in Ghana context. I think this community-based surveillance is kind of evolving area, and also we are looking at this is a very important program area under community protection. Therefore, we expect that we'll have a lot of discussion the way forward, and so we hope that we can engage further in this subject in the coming days and months and years. Let me, if time allows, then maybe I can pick up one more question.
Okay. One more.
Just one more. I think we should. Okay, so this simulation exercise seems like it is simulation exercise focusing on health sectors. In the structure and framework of response plan, it is only linked to MOH, and it seems his focus is the health emergency epidemic response linked to overall disaster framework at the local and national level to tap on emergency funding or response. I understand this question has many elements in terms of how health sector plan linked with disaster plan, and also how this plan also linked with overall disaster management framework, not only for national level, but also local level. At the same time, how emergency funding linked with response. So yes, this is very challenging question, I would say. However, since we look at specifically Ghana context, particularly district level, all hazard emergency plan, how that link with community. That was the one of the important aspects we look at in Ghana exercise. So I think this question is more relevant national level. Therefore, I think I should hand over this question again to Dr. Joshua for a little bit explain the national context in terms of emergency preparedness plan, how that link with other sector like disaster management sector. At the same time, how funding for response is really kind of managed or allocated from the national level. So some national context. Over to you, Dr. Joshua. My question is clear?
Thank you. Yes, very clear. And thank you for the question again, Dr. Rim. So I would explain a bit of the structure, and the structure, as you mentioned, is multi-sector. At the national level, you have a multi-sector emergency management system. The same thing happens at the two intermediate level, which is the region and the district. So you find health there, you find the disaster management organization there, you find veterinary there, you find security, and then you actually find the executive leadership, political leadership, all on these committees. So the plan is developed in a very multi-sector manner. What we are saying now is that beyond that, there should be clear representation for the community in the development of this plan, so that we are also invited to the table when the plan is being developed. Their local knowledge is taken on board. The goals are also agreed, and we offer the necessary training, orientation, and testing about the roles that we expect from them. And then at the same time, to make sure that the community is also oriented to the plan. And typically, you do your plan, even though it's multi-sector, and maybe the community is not even aware of the plan that you have developed. So that is really the big aspect that we have to look at when we're thinking of in placing the community at the center of our preparedness and readiness plans. When it comes to funding, and funding is usually a challenge, you wish you had ring-fence funding for response activity. Typically, this is a bit difficult to achieve, but you have to look at the support that comes from partners, support that comes from government, and actually, sometimes you find local level support. If you really approach it well, you find community members, community resources that can be part of the funding support for your various response activity. So these are the things that we are encouraging, and we ourselves hope to learn from them.
Very much, Dr. Joshua, for your excellent response. For the interest of time, I think I propose to stop this question and answer session, and I'll hand over to Dr. Supriya. Over to you.
Thank you so much, Dr. Rim, and thank you so much, Dr. Joshua, Dr. Charles, Dr. Kai, Dr. Claire, Dr. Patrick, Miss Sylvia, and of course, our leader, our director, Dr. Dedret, for this, for being here and presenting this work in this webinar so well. But I would also like to thank those who are not so visible, but have also played a critical role. First of all, in Dr. Rim's team, Lester Leroy and Yanni Brahan Fekadu, who are not here today. I'd like to thank the interpreters for the French interpretation. And I'd also like to thank Burke here, who's sitting here with us. Thank you very much. And Mim, who's in the background. Mim, if you'd like to put on your camera, but whose support has been invaluable in managing this whole webinar. I'd like to, my IT colleague Carlos was sitting here but has left. I'd like to thank him as well for setting up this webinar. But last but not least, I'd like to thank all of you, the EPI-WIN family, for joining us once again in this webinar. But please remember, these webinars are not just for one-way information. It's for you to make use of in your countries. So we will share the presentation. Someone asked for the checklist. I'll discuss with my colleagues, and if that's possible as well, we will do that. We will share the contact information for those of you who would want more information and want to know how to put it forward in your countries. And we hope that together, I mean, there's a lot of mention of together here, but it cannot be underemphasized. Together, we will take this forward for community resilience for the next health emergency. So once again, thank you very much. Before we end, two things. One is our next EPI-WIN webinar will be on 2nd May, and most likely will be on cholera management. But as I mentioned again, we will be having a partners meeting on the 7th of May. And please join us there. This is your opportunity to share your insights in a meeting where you'll have Dr. Nadret there, Deputy Director General of WHO there. We'll have our partners, IFRC Director Petra Corey, and many other leaders. But most importantly, it's your opportunity to shape community protection across the world. Be a part of that movement. Join this meeting. And I hope to see you in the next EPI-WIN webinar and in the partners meeting. Thank you so much. Bye.
Thank you.
Bye.
Thank you.